So how do you do the scapular repositioning test when it comes to Matthias? If you look at Kibler, it's a scapular retraction test. Can I borrow you, Ashley? So what we're going to do with these patients is we're going to have them standing, and we are going to attempt to affect the motion and also the position of the scapula using us. Essentially, I will be her serratus anterior and lower trap and having the ability to posteriorly tilt and externally rotate or upwardly rotate the scapula as she's going through a range of motion. For this test, what we're looking for is an increase in strength or a decrease in pain during this motion. And the motion that we're going to test is the empty can position. The empty can position historically has looked at the supraspinatus, which is the most common rotator cuff injured. However, we also know that between empty can and full can, there's really not that much difference in supraspinatus activation depending on the journals that you read. And I think that's one potential thing that we can exploit as we go at the very end of this blog. So what you're going to have the patient do is go into full 90 degrees of flexion. They're going to go into about 30 to 45 degrees of abduction with their thumb down in the empty can position. What I'm going to do as the provider is I'm going to have my hand right across the spine of the scapula, and I'm going to have my hand down, my forearm along the medial board of the scapula, and cause a little bit of compression here to force a little bit of stability. And I can actually test this before I do this and after. So what we're going to do is back down, and there's ways to test this with for strength. So up here and out, and I'm going to push down, and does that cause any kind of pain? And also, is there a loss of strength? And then we can test it with stability, which is when I'll be here and I'll cause a little bit of compression in the same position and push down and test again.